Assalamu alaikum dear doctors. In this video I am discussing how can we take the history of Guillain-Barre syndrome in short GVS. So here some picture is telling lots of things: peripheral nerves affected, nerve conduction study we do, and weakness in neuropathy, lower limb. Look, this is very important. Campylobacter is responsible. Now the chief complaints. What will be the chief complaints? The main complaints is unable to walk or difficulty in walking. Remember, unable to walk or difficulty in walking. So some DD will make before starting the history. It can be Guillain-Barre syndrome. One of the strong differential diagnosis is transverse myelitis, and others are it can be trauma, any tumor, and acute cerebellar ataxia. Now we are starting the history of the present illness. So we know that is complaint analysis and review of the system. So our complaint is unable to walk. First onset, course and duration. When it started, we'll ask. Then what make it worse and what make it better? Is it precipitated by any illness? So there is illness can be present like any gastroenteritis, or maybe it is after 1 month develop. Is it unilateral or bilateral? We ask. Is it the first time or recurrent occur, especially if asymmetrical, migraine and moya? Is the upper limb is affected or not? Do you feel his legs stiff or floppy? Is his foot dropped? Foot dropped, so any injury? Can he feel pins and needle? Any diurnal variations? Any swallowing problems? Any jaw stiffness? Ask about the motor level, that is, can he crawl? Can he sit? Ask about the sensory levels. If I touched his little finger, can he feel? Then we will go up till we reach the level. After analyzing, we ask some general questions like, does he look like you and his daddy? Does he have any chronic illness? Any other concerns? Then about the FWASL and activity, that is fever and weight is gain or loss, activity and sleep is affected or not. We are starting the review of the systemic review one by one. First CNS, we ask that signs of any increased intracranial pressures, abnormal movements, facial asymmetry, fits, eye deviations, abnormal behavior, any concern regarding his visions, hearing or speech, any changes in size of the head, bugs in the brain or shunt. So these are from CNS we ask. Then GIT, tummy pain, tummy size, poo nature, and if he had loose motion before, ask about poo control. So poo is very, very important. We ask the nature of the poo, and if he had any loose motions before, ask about poo control. So describe the poo details we know. Then CVS, we ask awareness of the heartbeats, chest pain, how many pillows, anybody, edema, eyelids, lower limb and tummy. Chest, we'll ask any chest pain, breathing problems, cough or cold, barks, snoring sound. Urinary, we ask the pee control, pee color, amount, painful peeing and blood pressure measure. And pee control is important for transverse myelitis. We are differentiating. Then MSK, we ask any skin spots, describe skin discoloration, joint pain, joint swelling, bone ache, anybody lumps and hair or nail changes. So we know heinous colon purpura, sometime HSV, they can ask like unable to walk, arthritis develop, that is. Then endocrine, blood glucose level we ask, and hematology ask the pallor, bleeding and any recurrent bugs. About the past history is as well 5T IOA. It is very important to ask about any trauma. So one of the DD's trauma I already tell, and head, legs, back, neck, any trauma present or not. Recent travel and contact to COVID patient we ask. Perinatal history ask any event in pregnancy, jelly scan results, newborn screening and NICU admission. Puberty ask started menses, if is it regular, boyfriend, OCP, protection. Vaccination we ask, very important, is his vaccination is up to date. Because of polio, any recent vaccines, parents received COVID vaccine. So polio is already eradicated. Allergy history we ask, nutrition history ask on a special diet, type of food, amount and growth chart. Development we ask, important if child less than 2 years, in detail and growth chart. Family, similar condition, sudden death in the family, social, school, psychological and impact. So this is history of the Guillain-Barre syndrome. Now about the discussion part. So what is your differentials? That it can be acute flaccid paralysis, then infection like polio, ascending, diphtheria and botulism, descending manner. Post-infection and autoimmune, that is Guillain-Barre syndrome, GBS, transverse myelitis, sensory level, due to infection and triggers and autoimmune demyelination of the nerves, trauma, tumor, acute cerebellar ataxia. So these are the differential diagnoses. Now what investigation would you like to do? Suppose that is GBS. So first we do the lab, CSF, cytoalbumin, dissociation with high protein and normal glucose, no cells with negative culture. EMG, that is electromyography, acute denervations. Nerve conduction study is slow. Nerve conduction velocity. Anti-ganglioside antibodies, GM1 and antibodies against the Campylobacter we do. Stool analysis we do. Imagine we do MRI of the spine to rule out any spinal cord lesion, X-ray of the pelvis and bone, tibia and fibula if unilateral. We do bedside blood pressure, ECG and spirometry. Next question, how will you follow up? So follow up with the neurological examination, cranial nerve examination, spirometry and blood pressure measurement. And when the prognosis is poor, what are the prognosis of poor in GBS patient? Number 1, any cranial nerve affections. Number 2, respiratory affections that requires ventilations. Number 3, maximum disability at time of presentation. Number 4, bulbar affections. And number 5, no improvement after 2 weeks. Next question is that how can I treat this case? So this is GBS. I will admission to the ICU. Airway, breathing and circulations. Then daily spirometry with FVC follow-up. That is forced vital capacity. Because respiratory failure is sudden and life-threatening. I give IV immunoglobulin, plasmapheresis, physiotherapy and rehabilitation, steroid if intermediate or relapsing courses. And also I involve the multidisciplinary team. So what are the team I will involve? Neurologist, pulmonologist, physiotherapist, occupational therapist, SALT, that is speech and language therapist, dietitian, ophthalmologist, cardiologist, liaise with the school, skin care for pressure ulcers. Why it is not polio? Because no cranial nerve affections, asymmetrical, no sensory affection, no autonomic affection, CSF, no lymphocytosis, nerve conduction velocity is normal in polio, isolation of the virus in stool. What are the causes of Guillain-Barre syndrome, GBS? We know common organisms is Campylobacter, Helicobacter and COVID-19. Precipitate vaccination is OPV, MCV, rabies and flu vaccine. What are the complications of GBS? These are respiratory failure, fluctuating blood pressure, arrhythmia, urine retention and constipation. So this is all about GBS history and discussions. Please do subscribe and share MRCPCH with Dr. Emma Choudhury. Thank you.